There is an enormous gap in healthcare coverage from a capacity perspective. So it's estimated that by 2013, the WHO, there'll be 18 million, there'll be a gap of 18 million workers, frontline healthcare workers, and frontline healthcare workers deliver most of the healthcare in the global health setting. And so there's a huge gap in caregivers, combined with there's still an enormous burden of avoidable deaths, especially in children under the age of 5. There's estimated to be 5.2 million deaths a year that are avoidable. So if you think about that context, and that's today. In 2014, when ThinkMD was started, and it was started by two pediatricians, Dr. Barry Finette and Barry Heath, and how it really came to be, Dr. Finette specifically has traveled the world at Project Hope and UNICEF and Doctors Without Borders, and had been traveling to sub-Saharan Africa specifically and delivering care to patients in those settings. And what he realized as he was on his way back from those trips was when he left, nothing really changed at that point of care, because it was going to go back to the way it was. And so he was delivering great care at the moment. And as soon as he left, unfortunately, the system would go back because there were no tools and no technology. And so the thought was simply, how can I take what's in my head as a clinician, and is there a way to use technology to sort of think the way that I think? There's ThinkMD connection, and if I can build that logic using today's technology and artificial intelligence and machine learning, and give that tool to a community health worker or a frontline health worker, we can have an amazing impact on healthcare. And so Dr. Finette and Dr. Heath began building those algorithms. They spent the first 3 years working on the technology. And then they took that technology, or we took that technology, and we tested it in over 1,000 children in 5 countries. And what we learned from some of that work was that what we had built in our clinical intelligence correlated to what a doctor would assess in roughly 85–95% of the time. So we were highly accurate with a tool to what a doctor would say. And how we figured that out was we did trials where we would have the frontline healthcare worker use our tool, do the assessment, and then that child would see a physician. And that's how that correlation was built. We then published that in the Journal of Tropical Disease and Medicine, and it was peer reviewed. And from that, we've expanded, and we're now in 10 countries, and working to expand beyond that, and continuing to really drive this mission of helping reduce avoidable deaths across the world. And healthcare, as you know, while we're in sub-Saharan Africa and Asia, typically is our 10 customers right now, we're working in other parts of the world as well, because healthcare is a global challenge, and this capacity is a global challenge.
That is one inspiring story. So moving on to our second question, how is ThinkMD changing the status quo in healthcare and digital health?
Yeah, great question. So, the status quo is there are not good tools at the point of care. There are tools that aggregate data, electronic health records, and systems that hold information, but there aren't a lot of tools for the frontline healthcare workers specifically. If you look at what's happening mostly globally in that workforce, it's very paper-based. I'm taking information charts, I'm filling it out when I see a patient, and at some point that gets up to a Ministry of Health or a program manager, and they enter it into an EHR, but it's not available for care. We're changing that paradigm by putting the tool in the hands, my phone, any phone, Android, it doesn't matter. Most of the world is Android, not Apple. And our technology downloads to those phones, and we've built it in a unique way with a tool called a progressive web application. What that means is we know that healthcare workers in rural areas and settings may not have internet access. You can download our entire tool without once when you get to your, say, home base, and then when you go out and deliver care, you can use the tool completely without being online, and then come back. And when you connect to the internet, all that information and data loads up. So we're basically, what we think about is if your first assessments in healthcare, even yours or mine or anyways, are wrong, right? What happens? Well, what happens is I started health. One, I may have a very significant clinical impact from that wrong assessment. I may take the wrong medicines. I might never get to the real issue. I may start a healthcare journey with a provider or a doctor that thinks one thing when I should be treated for something else. And so it causes waste, it causes cost, and worst of all, it can cause ultimately death. We really believe that what we're doing is enabling the right healthcare journey, because with our assessment, which we know gives an accurate risk of certain conditions, you can then know that I'm starting my journey on malnutrition, dehydration, pneumonia. That's the right way. And then when I move through the healthcare system, I'm going to be better cared for. And that's pretty exciting. And for the frontline healthcare worker that doesn't have a tool to be able to do that on their phone or their tablet, is empowering for that group that is really caring for much of the world's people.
Nice. So Chris, after founding ThinkMD, can you describe what was the first year like?
So I am not Dr. Finette, right? So I'm not Dr. Finette, but I was one of the first 2 or 3 early investors in the company. So I was in the room when the first Dr. Finette and a couple folks on the team of 3 right then, were sort of pitching the idea. And I remember us talking about how are we going to build this technology with little money and a small team, right? Because that's the challenge that startups have, is how do you build the dream early with limited funding and really no assets, no team. You got to build that. Technology is about having the right people to build it. So we funded, me and a couple local people here in the community funded that initial work. And Dr. Finette was fortunate to get some grants from his research work to fund that as well. And that really helped make a big leap to getting the base algorithms and clinical intelligence built. And once that was built, then we had the opportunity to get it out into a few countries and programs. And Save the Children was one of the first ones that we worked with, and they were very open to obviously our technology and piloting it and helping us, because they saw the value, right, on the ground in the places that they work. And so, the first year was, we have an idea, how do we fund it? How do we make it stable enough that we can get it in the field, in its basic form, and test, hey, is this really going to work? And can we take the next steps? And fortunately, it did work, and we were able to take the next steps, which allowed us to get additional grant funding and grow the business. And now, this may be a subsequent question, but now we're at a place where, with more funding and more eyes on ThinkMD, we're able to scale to the next level, right? Startups go through phases, and we're going through one of those growth phases, right now.
Great to know that. So how has ThinkMD evolved over the last few years?
Yeah, so on the heels of that last question and that response, again, starting out, really the tipping point was in 2016, 2017, when we were able to get the studies really validating that this technology in the hands of a frontline healthcare worker can change lives and can provide quality care and really make a difference to a patient, a baby, an adolescent, a mother. That was historic. And getting that published was validation, and that allowed us then to really expand to other countries, and along the way build new capacities and bring in skills that we needed, not only to build our clinical engine or our clinical brain out, but also around data. So we're collecting, when frontline healthcare worker does an assessment, and we can assess over 250 different disease states right now and different risk categories of those diseases. When an assessment's being done, the frontline healthcare worker doesn't even know. In the background, we're collecting data based on how they're answering questions. How they're answering and what they're not answering is information for us. So we've amassed a significant data set as well that helps countries look at disease management, disease surveillance, population health trends, and that is significant. So we've built not only the clinical engine that has evolved, but the data aggregation and tools to help us actually take action with this information. And so the company has grown from 2 and 3 people to now we're at 16 people, mostly in the technology and building the product and the data side of it. And we've gone from sort of year-to-year grant survival mode, which is challenging in this space, and it's nerve-wracking, as you can imagine. Are we going to get that grant or are we not? Because if you get the grant, you can hire more people to do the work. To 2 significant events recently. The first was an additional grant from the Bill and Melinda Gates Foundation. That was a multi-million-dollar 2-year grant, and that grant specifically is around helping us bring on skill sets to help our product be more interoperable in the healthcare technology ecosystem, so that we can plug into one of those EHRs I talked about that hold data, so that at the front lines of care, we can do our work and it'll automatically flow to the EHRs. And so that work is specifically what the Gates Foundation grant is helping us build and do, and we're in the midst of that work right now. And along with that grant, we also were fortunate enough to secure additional growth funding from private investors, and that is allowing us to scale. And so we're looking at scaling our commercial team so that we can be in front of more programs, more countries. We're looking at expanding more aggressively in the US healthcare market. We're in conversations with Google around their health ecosystem. And so it's very, very exciting. So we're at a point now where we can take a breath, and we're sort of moving, where we are evolving from that, scrap it every day, prove this thing works phase to, okay, we've got 10 countries, thousands of users, to now how do we take that and really scale it to have the impact we know we can have? And how do you build the internal systems and the environment and the culture that you want as a startup grows, which is always, always challenging and fun, and so we're at.
That is all very exciting. So Chris, on a more personal level, looking back at your journey, what are you most proud of in ThinkMD?
Yeah, I will say from my perspective, specifically, as an investor early on, being able to see a company grow, most startups don't make it. That's just like a fact, right? We all hear about the ones that do, and they go really big, and you're like, wow, it must be easy to be a startup, because everybody, goes public, or they go crazy, right? Like we've seen in the last, 10, 20 years. But it's really hard, and most don't make it. And I think when you make it, it's very exciting. And making it, depends on what your goal is. But for us, we have set a goal. So we are now on a steady path of growth, and we have set a goal we did last year about 200,000 what we call quality health encounters. Those are assessments with mothers, babies, adolescents, children under 5 with our tool at the front line of health care, right at that point of care, in a small community, in a clinic, potentially in a village in the middle of nowhere, in some of the countries that we work in. So that roughly 200,000 encounters creates over a million assessments that the system's doing. Our goal is to grow that 200,000 encounters to 250 million in 5 years. So from 200,000 to 250 million, 250 million in 5 years. That's our goal. And to do that, we've got to get our tool in the hands of 50,000 frontline healthcare workers. Right now, we're in the hands of roughly a couple thousand. And we've got to obviously do a lot to move that needle. And we've got to invite people in, other organizations, to help us achieve that, which is really our goal, to build a coalition to make a difference. And when we do that, when we do 250 million encounters, we're going to do, we're going to find people that are in critical conditions, and we're going to impact their lives in a positive way. And we're going to create data that's going to be able to inform countries and programs about disease states, and let them go in and take action to help people live better lives. And so it's a really exciting goal. And it's a lot of work, because we've got to scale up the company. We've got to keep building the product. But every person that we're able to enable with our technology in their hand, we're going to be moving towards that goal. And so that's really our dream right now.
Best of luck for your future goals.
Yeah, thank you.
We hope you achieve them. So what are some of the challenges that ThinkMD has faced as it has grown?
Yeah, great question. So, I think that the two main challenges, there are actually three. First is, nobody is doing what we're doing, having a technology, trying to think like a doctor, taking in a lot. If you go to the doctor, right? When you go to the doctor, you walk in, and they're looking at your chart and weight and height and how you feeling, you're answering questions, and they're also looking at you, and they're doing a lot in their brain we don't probably know they're doing, right? And to come up with a sense of what's wrong with you, or not wrong with you, which is equally as important, right? And to put that in the product and make our product do that is a lot of work. So the challenge of validating that will always be on us. So as we bring out new tracks, so we have focused, Barry Heath and Barry Finette, the founders, were pediatricians. So clearly we worked on building out our technology and our intelligence in that space. So moms, babies, children under 5, adolescents. We're now scaling it to adults. So we have to continue to validate our work, right? And find partners that'll help us validate it. So that's one challenge. To do that, you have to have willing partners in the global health space. There's a lot of technology. Digital health is a big buzzword right now, as you know, and based on all the people you talk to, right? And so differentiating yourself so that people say, I need that technology, is really important. We think we've done that recently in this last funding round. Save the Children joined that round as a significant investor, which is, they don't do that. We're the first health investment in a new impact fund that they have. So that's very, very exciting, and it's a validation. So the funding will then help us find the people to grow the business. And the challenge for us is finding skilled people. It's a tough market to find quality people, and we always struggle with that. And our challenge too is, we are a Vermont-based company. We're a public benefit company, which means we get to focus on our humanitarian and social causes first, and our finances second, to simplify it. But we're a Vermont company that is, all our customers are global. And so we need to also be able to build out a global workforce in time, in country for country, so that we can find people that can help implement our product, support our product. We do have physicians that are on our advisory board that are in Nairobi in Kenya, and they're helping us develop new tracks from a clinical perspective. But those are the challenges. So continuing to validate our clinical intelligence and data models, funding to find the right people, and to be able to bring those people in and have them be as passionate about what we're doing as we are, and help us think and build the products and the infrastructure, and then extending to out-of-country resources to help us grow.
So Chris, what is your goal for both ThinkMD and yourself over the next 5 to 10 years?
Yeah, so for ThinkMD, it's really clear. It's 50, get our product in the hands of 50,000 healthcare workers, doing at least 250 million quality health encounters. That's our term. A quality health encounter is a frontline healthcare worker and is somebody at the front lines of healthcare using our technology. I've talked a lot about frontline healthcare workers, community health. Well, that could be a doctor, that could be a parent who uses. We have our product in tablet form in pharmacies in Kenya. Good Life Pharmacy chain in Kenya is a large pharmacy chain that's sort of like a CVS in the US. They're more upscale than the typical pharmacy is in sub-Saharan Africa. And they're trying to sort of change the paradigm. And in that setting, 70% of people get their healthcare at the pharmacy. They start at the pharmacy. So we have our application, our tool on a tablet in the mom and baby segment. So a mom is using our tool to do an assessment. Whatever user that is, a parent, a frontline healthcare worker, a doctor, but is growing that user base to deliver those encounters, and then taking that data to make a real impact to inform health decisions across a community, a state in Kenya, state in Nairobi, in Bangladesh. And it's really to expand the product use so we can have the data to help people take clinical actions. And the goal is clear, it's for us. And we also want to bring along other organizations on that journey so that we can really help global health be more effective in moving technology to the front line of healthcare. Because right now it's tough. There's a lot of players, there's a lot of politics, there's a lot of bureaucracy. We want to figure out how to cut through that to get the tool so it can make a difference. Our relationship with Save the Children, them being part of our funding round, and we are working on what's called an enterprise access agreement so that they can get our technology quickly out to the front lines of care without having to go through contracting with every country, pricing with every country. We're working on that right now, a global agreement, so they can quickly push it out. So that's really exciting, and we think is a game changer. And we hope as we move down the next subsequent years, more organizations like Project Hope, UNICEF will do the same thing and get so that our technology can be deployed in a matter of days, really, once it's configured for a country. We're in 14 languages right now. And so once we're configured for a country and language is done, the training for users a couple of days. So it's really exciting. So hitting those goals they're lofty, but they're exciting. And for me, leading the company and working with Dr. Finette as in partnership, I think we've got the ability now for Barry Finette and Barry Heath to just focus on building the clinical, and I can focus on scaling our infrastructure so we can do that successfully. It's really a good match.
It really is. So could you tell us about a few current projects that you're working on?
Sure. So we are, I shared the Good Life story. So we have been working, we have had our tablets in pharmacies in Good Life in about 20 pharmacies. And the whole intent there is to be able to reach out to the consumer so that a mother or a father, for that matter, can come in and take an assessment and be able to talk to the pharmacist about that assessment. And we're extending that work to be able to potentially move to prescribing drugs or indicating a telehealth session with the providers necessary. And so to do that all at one place, it's an exciting program for us. In Somalia, we are in 22 clinics with our partner Alight, and we have providers that have last year did over nearly 30,000 encounters, and we had a high percentage of those were urgent risk assessments that moved the patient positively forward. We're working with the CDC in Bangladesh to look at conditions in Bangladesh in a joint project with Save the Children and CDC, which is really exciting. We're having conversations with a private company called VF. VF is a garment manufacturer that has millions of workers worldwide, and they have primarily paper-based systems in their wellness centers. So within factories, where we know some of those conditions can be less than ideal globally. They're looking to put our technology in so that their workers can use it to do assessments. And so we're really excited about that. And that's about the wellness of their workforce and their families, because obviously they can be a mother and do an assessment that can help a family member. So we're in a pilot program in the US with the University of Vermont, where we're having our application have the parents access the application. And this was driven through COVID and people not going into the office. So they can reach out to the UVM website and have access to our product to do an assessment, and then the provider has all that information when the parent calls. They say, "Oh, I see you did the assessment. I see here's what's going on. Okay, here, let me take that to the next step." So we're in talks and conversations with Google about really the Google Health ecosystem, and how there's something in the industry called symptom checkers. Symptom checker, you may have used one before, WebMD, all kinds, where you go in, you put in, I've got this, this, and this, and it says, oh, you have that. We are not a symptom checker. And we are the clinical intelligence and are thinking like a doctor. The assessment, our logic is very different from that. Google is an organization that understands that. Symptom checkers typically always go worst case. So, go to urgent care, or, you may have cancer, go to your doctor, right? It always sort of gets to the worst case. And that costs a lot of money in the system. And so the thinking is, with a smart, intelligent brain like ours, doing an assessment that is more accurate and higher quality, that the patient may be able to do a telehealth visit, may be able to stay home and just take aspirin, or whatever the case may be. So we're in multiple settings doing different things, which is really exciting. We've got a lot of programs around those. And so, as those become more successful, we'll build on those parts of the market.
These are some really exciting and innovative projects that you're working on.
Yeah, thank you.
So, Chris, when you're not working, what do you enjoy doing for fun?
Well, let's say I work a lot, and that's fun. I love what I do, and I love our company, and I love, more than anything, our cause and the ability to do something that makes a difference in the world. You can, like, sleep well. I train for triathlons, so I'm a wannabe triathlete. So I am not a very good one, but I'm trying. So I run, bike, and swim every week. I have a wonderful family. I've got 4 kids, and they're all in high school. 19, 18, 19, 18, 16, almost 15. So my hands are full with basketball and soccer and sports and college looking. And so that takes a lot of time as well. And 3 dogs to boot. So we got a lot going on, but it all works. It all blends itself nicely together.
Oh, great to know that. So our last question, Chris, what tips do you have for the others who are thinking of starting their own company, just like ThinkMD?
Yeah, I think you have to have a grand idea that you're really passionate about, because starting companies is really hard. My wife is part of a startup. She has a custom leather bag company called Ma and Pemba, and they have a great idea. They've got a great following, and every year it gets a little bit better. But they also, every year as a startup, you find new challenges, and you have to be determined to get through them. So I think, being resolute in your determination is really important. There are there's 1,000 great ideas, but taking the risk to say, I'm going to actually make this happen is the first big step. And that's the determination. And then sticking with it is being resolute in that determination, and being really creative. There are, if you think outside the usual box, okay, how am I going to fund this? Where am I going to find people? There are so many organizations, and there's so much funding available for startups. There's, especially around healthcare. My wife's startup is a woman-started led company, so there's funding for that in unique ways, right? Minority funding. there's a lot of funding for ways to get money. So you typically finding some money won't be the problem for somebody starting a company, because you can find enough to get the idea going. Really test it and listen to the market, and listen, based on what you want to do, understand what you're trying to solve. I think the biggest challenge people have is they start something and they love the idea and they have a sense of what it does, but they're not touching the market it's intended for. They're not really understanding the need. And then they get a year or year and a half into it and they realize, oh, I missed the mark. So having the determination to start, having and then I guess the smarts or the flexibility to say, understand what's in the market and be willing to know where you fit, and then go for it is really important.